Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this video, the doctors talk to you about ovarian cysts.
Hello. Today, I want to introduce you to a friend and colleague of mine. This is Aaron Armstrong. He is an obstetrical gynecologist. He practices at Lakeside Women's Hospital. I wanted to ask him some questions today about ovarian cysts. Aaron, how are you doing?
Doing
You
great.
okay?
Great to be here.
I'm glad to hear it. Thank you for joining us today
Thanks for asking me.
to visit. But please tell me about an ovarian cyst. What if I came to see you as a patient and said, I've got an ovarian cyst. What do I need to do about it?
Okay. This is a question we get pretty often. Maybe it's just an incidental finding. They have some abdominal pain. They have imaging done, and they see an ovarian cyst. And patients come in concerned, hey, is this something wrong? What's happening? Why am I having these ovarian cysts? And so normally try to talk to patients to give them some reassurance, because majority of ovarian cysts are found are normal. Your ovaries are supposed to have cysts. In fact, that's one way for us to identify your ovaries on imaging, is that they have cysts inside of them. There are abnormal cysts though as well too. So we have to kind of distinguish, is this a normal cyst or is this an abnormal cyst? I talk to patients and explain that normally every month when you're having your periods and having the cycles, there's a couple places in your brain that talk to each other that then send a message to your ovaries, telling them to produce an egg. At that point, then there's a race. Hundreds and hundreds of eggs are trying to become the egg that month. And eventually one gets chosen. And so then the ovary then tries to make that egg mature. And as that egg is maturing, it'll form a cyst around it. And so we expect to have a cyst form every month. Eventually that cyst will get large enough as that egg gets mature that it'll actually rupture and release that egg. And the fancy word for that is ovulate. So finding a cyst on an imaging study is not abnormal. A lot of times those will resolve, they'll go away within the next cycle, and we can follow that up and see what has happened to it with either some repeat imaging in 4 to 6 weeks or so. So they're not always bad.
Perfect. That's a great answer. Thank you for explaining to us that that's a normal thing. And so if we see them normally, or every female's body is supposed to be doing that.
Right.
The ovaries are working properly.
Exactly. It's a
Excellent.
great thing to take a breath and be okay.
Good. That I'm sure helps assure many people that, hey, take a breath, like you said, take it easy, don't worry about it. What if it's bigger than you would expect, or it doesn't go away?
Okay. So if it does continue, if we do see it, one thing that we can do is we can help to suppress new cyst formation. And that's when we normally utilize either some birth control, which is really period control, but we utilize some birth control medication to help to suppress any new growth, and we'll monitor that and see if it resolves on its own. If it doesn't, then we can look at the characteristics of the cyst. If it's just a fluid-filled cyst, once again, that is less concerning. But if we see a cyst that has actual solid components to it, or even calcified components to it, that's an abnormal cyst. We sometimes have to investigate that further. Sometimes even leads to doing a procedure till we look inside and do a laparoscopic procedure or an open procedure to look at the ovary and to see what that cyst is, and even have to remove that cyst sometimes.
So in that case, those cysts would not go away on their own. It won't resolve on its own.
Yeah, those would not resolve on their own.
Okay. Would that require another couple of meetings with you or their physician in an office type setting, or does this take longer than that to figure out?
Well, normally
injuries indicated.
We would follow up with the repeat imaging. And so for most cysts, if they're going to resolve, we normally see them resolve within 6 weeks, because once again, that's a different time in your cycle. And so we would expect if that's a normal cyst, it's going to go away by the next time in your cycle. So 6 weeks is kind of a normal time frame to do repeat studies on. And if we don't see resolution of the cyst at that point, then we definitely get more concerned that, hey, something probably needs to be done about this.
Okay, perfect. That makes total sense.
Yeah.
Thank you for sharing that with us.
From
Do you have any other words about treatment? We've talked about that, not in great detail.
yeah.
Anything else to elaborate on?
Well, definitely treatment for abnormal ovarian cysts. Once again, it's all about suppressing that signal from the patient's brain to the ovary, so we're not creating new cysts. If we have multiple cysts being formed, you can imagine as they develop, they kind of combine to make a bigger one and continue to combine to make bigger cysts. So by suppressing new cyst formation with birth control, then you don't get that growth. And most of the time, those cysts will just resolve on their own. They'll get to the point where they drain and they go away.
Okay, perfect. That sounds great. I want to thank you for joining us today and giving us some insight about ovarian cyst. It sounds like it's a very common thing, and it's something that we just need to watch and can take it further with you and further imaging studies if need be.
Absolutely. I think just because you have a cyst on your ovary doesn't mean that it's bad. And I just wish more patients would know that and take a deep breath about it.
Okay, perfect. Thank you for joining us today, Aaron.
Thanks for having me.
You betcha. Bye-bye.
Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health. Please contact us at SheTV.com if you have comments or a particular subject you would like us to address.